Frozen shoulder is an inflammatory condition that causes inflammation on the inside of the joint lining of the shoulder and eventually leads to thickening and scarring of the shoulder capsule. We describe frozen shoulder as going through 3 stages. The first stage is predominated by pain, and that's usually because of the inflammation inside the shoulder. It then progresses on to the second phase, where there's pain and stiffness. And the stiffness is caused by the scarring and thickening of the joint capsule, as well as by muscle spasm from the pain. Eventually the pain goes away and the stiffness takes a longer time to settle and improve. And we have said to patients in the past that these phases can be completed and frozen shoulder would resolve within 2 years. But we now know in studies that up to 7 years, patients can notice a difference in their shoulder when they're affected by frozen shoulder. Most of the time, frozen shoulder doesn't have a specific cause. So it's not usually affected by an injury or certain sports or types of work. Frozen shoulder most commonly affects people in middle age, from about 40 to the age of 65. And women are affected more than men. While diabetics get a more aggressive form of disease, most of my patients with frozen shoulder are actually not diabetic. While there are no specific exercises to prevent frozen shoulder, it's important when you do have a frozen shoulder to keep the shoulder moving. I usually recommend that patients try to do all their activities of daily living and not to favor the affected arm. If the shoulder's getting stiffer, then you can use things like warm compresses or the shower, and you can try to walk the arm along the wall out to the side or up in the air to try to help to keep movement. But often, if patients are losing movement rapidly, I'd refer them to a physiotherapist to try to prevent them losing further range of motion. How we manage frozen shoulder depends on the phase that the patient's in. If it's in the very early phase where pain is predominating but they have full movement, over-the-counter drugs like anti-inflammatory drugs can try to help with some of the inflammatory symptoms and pain. If over-the-counter medication don't help with the pain, then an intra-articular steroid injection can help relieve symptoms in at least half of patients, and that would be all they need to help them start to recover from this. If the patients present late, where the main problem is stiffness, and that stiffness is preventing them from doing work or normal sporting or recreational activities, or if they haven't responded to a steroid injection and are still in pain, then keyhole surgery to release the scar tissue in the joint and take away as much of the inflammatory tissue as possible is sometimes necessary. And this is a common day case operation that we do, with the patient often awake under regional anesthesia, that offers good, reliable recovery for patients. Surgery isn't always necessary for frozen shoulder. If the disease is caught early enough, then a simple steroid injection may be all the patient needs. The steroid injection must be done into the joint. If patients don't respond well to a steroid injection, or if they present later with the disease where the main problem is stiffness, then surgery is often needed, and this is usually done as a keyhole day case procedure, often awake under regional anesthesia, and the goal of surgery is to take away as much of the inflammation and scar tissue as possible to free up the joint. And this is followed by aggressive physiotherapy afterwards to maintain the movement that surgery has achieved.